Yeah, so hello, doctor. Welcome to Nisarga Herbs. We are very thankful to you for taking out time and visiting us today. So, first, I would like to ask you, what was your experience with Nisarga Herbs and how long you have been using the products?
I'm also happy to be here. Thank you for welcoming me. So I've been using Nisarga herbs for the last 15 years in my Swiss practice for Ayurvedic medicine. Originally, I was looking for a manufacturer who could give me more potent medicine. So this idea of Nisarga with using critical CO2 extracts appealed to me.
Yeah.
So we started producing according to my formulation, and also some formulation of Nisarga. And then we made about 20 preparations to start with. And with them, I've been working successfully in my practice. So no side reactions and very happy patients. Of course, some of them are the main sellers, other ones, less indications are there, but that comes with, that's natural.
So, what did you feel that is different with other extracts or other Ayurvedic medicines and with Nisarga herbs? What is the difference that you felt?
Also, we need to have a total extracts where everything of the plant is in the medicine, not just to take some of the active ingredients out. So do have the whole plant intelligence with it as described in Dravya Guna. So that's why it works so smoothly.
Yeah. So next, I would like to ask you about particularly about the Sorosim oil that you have been using right now on your patients of psoriasis. So what were the results of the patients whom you used the oil?
Well, on the last visit to Switzerland of Mr. Soman, he showed me some photographs of these new products, the effects of it. So I asked for some samples. And with the samples, I gave to about half a dozen, actually more, about 10 psoriasis patients who come regularly to my practice.
Okay.
And asked them to immediately give a feedback how it worked. And everybody came back with amazing feedback. Some even sent me photographs of before their joints were heavily infected by psoriasis. And then just after using it for 1 week, the inflammation came down, the itching came down, and the skin looked much better.
Okay, so would you like to elaborate on psoriasis, how it is manageable and what ingredients helped to improve the condition in the patients?
Of course, psoriasis, according to Ayurveda, is kushta, and kushta is a chronic disease, so it doesn't just go away.
Yeah.
So it requires also a lot of effort. In Panchakarma, we recommend Vamana Karma and Virechana Karma, which all we are doing there, and also we're giving them some internal medicine. I also have Dermatone, one of the formulations I did with Nisarga. So for internal, I give them that. And external, we are using now, after the trial period, this new psoriasis oil.
Yeah. In the psoriasis oil, that is Sorosima oil, we are using ingredients like bakuchi and karanza and neem. So we are also using some anti-inflammatories like turmeric as well. So would you like to elaborate on how it works on the skin of the psoriatic patients?
Yes, because I can see from the formula you made that all the doshas are taken care of. And that is the difficulty in treating psoriasis and other chronic skin ailments, because sometimes Pitta dosha is more maybe in the origin to start, and then Kapha or Vata dosha are more, and with the herbs, Bakuchi, the anti-inflammatory part, with Neem, Vata, so Kapha and Pitta are taken care of. So in this way, it will work on the tridoshic principle.
Okay. So, what were the feedbacks of the patients whom you treated for psoriasis? Any positive feedbacks or like any reactions or any that
The
sort of
feedback
things?
was very positive. Some of the patients are already under treatment with me for many years. Some of them came newly. So even those who had undergone already panchakarma treatment with me and got some relief from that, but still after 1 or 2 years it came back. And sometimes the hands are completely, they had to wear gloves to go to work. And with the new oil, we were able to get immediate relief.
Okay. So, how did Sorosima oil help to improve the quality of life in the patients of psoriasis?
Psoriasis patients, they have a long suffering period. So they already tried out everything. They tried out the immunomodulators with heavy side reaction. They tried out cortisone preparations, which in turn make the skin very thin and very bristle. So actually the problem becomes more. And with this Sorosima oil, the skin actually becomes really soft. It's not only hydrating, but it makes the skin soft. They can move better, less tension of the skin, less pain. So that is a great benefit for this patient.
Also, it helps to moisturize the skin and it penetrates really deep. So, it may be very helpful for long term, right?
Exactly. Yeah.
Yeah. So, have you been able to use other medicines in different ailments of Nisarga herbs, like for like stress or like diabetes or any other ailments?
So my main runner is a preparation which I got registered in Switzerland as Emultone. And it helps to immunize the whole body system. It has many different indications. So from allergic, like now in Europe, the hazel bush is getting his pollen free, and a lot of people are allergic to that. So with that Emultone, it gives immediate relief. And also during Corona period, it was like a natural protection. So that is one of the main sellers. Then, of course, stress-related problems. For that, I have another medicine registered as Neuroton, which is a formulation also together here we developed. So in that way, we have all these different preparations that are very powerful.
Yeah, thank you.
Have you used any of our products for managing the neurological conditions, and what is your experience with it?
Yes, a very good experience in ADHS. And even surprisingly, many adults in Europe suffer from that. Of course, we also give it to children, but it's also working very well in adults. Then other neurological products in sleeplessness, in stress situation, work very wonderful.
Have you used any of our products to take people off the allopathic medication, especially from depression or
Yes.
chronic depression?
Yeah, that's not a very difficult thing. I mean, antidepressants we can replace after some time. I tell them it takes about 35 days until they go through all the dhatus. And they should take it, and after 35 days, then they will reduce the modern antidepressants.
So you mean to say that you taper the dosage for the antidepressant medication using Nisarga Herbs products?
I don't taper the dosage, just the frequency. I tell them take it one day and one day not.
Okay.
And then one day and one day not. So the body gets always the full dose of the modern medicine when he gets it. Or even difficult cases, I tell them take it 2 days and then one day off. 2 days.
Okay, so that is how you withdraw them.
And like that, we phase it out because some of the antidepressants will have a flashback, and that will not be suitable.
So what you do is basically increase the frequency of taking the modern medicine by using our products.
Yes, and then phase it out completely.
Phase it out completely in about a month's time or 2 months' time?
Depending on how long they've been taking it, but the early ones, if they are with me in a panchakarma treatment and they are under supervision, I can take it immediately off.
Within a month?
Yes.
Okay. Do you have any experience with Nisarga Herbs for chronic rheumatoid arthritis?
Another difficult disease to treat.
Yes.
And again, the medicine in use are very questionable. I mean, the modern medicine. The ones are that they are acting on the immune system.
Yeah.
Then they get sick very easily on infections. So, and also the side reactions are there. And the other one, of course, are the cortisons again. And we can replace some of the medicine also here, especially if
steroidal medication.
Even steroidal. I mean, if they're down on 5 mg of steroids, we can take them off and replace it. If they're up on 70 milligrams a day,
very difficult.
we first phase out the steroids, go down to 10 mg, and then once they're on 10 mgs or even 20 mg, then you can start phasing it out.
So you are able to manage your patients after removing the steroids completely with rheumatoid arthritis using Nisarga's products made for you?
It is manageable. I don't say the disease doesn't go away. It's a chronic ailment.
Yes.
But if they don't agitate the dosha, then the pathogenesis is only possible when the doshas are disturbed. So along with that, the food habits, lifestyle habits have to be regulated. So then we can expect that it doesn't come back so quickly.
With your experience of using Ayurvedic medicine for over 40 years in India as well as in Switzerland, you have started using our patented technology for making the formulations using our holistic extracts prepared using our Nisarga's patented technology. What are your findings with these extracts? What is the difference you have noticed in your patients when you use this as compared to the other formulations?
It acts quicker and it acts more potent. And even some of other Ayurvedic professionals in Europe, they can see if they just buy some conventional medicine, Ayurvedic medicine, and as opposed to the Nisarga, I mean, they're surprised how fast and efficient acting the Nisarga products are.
Thank you, doctor. Thank you for your compliments.
Thank you.
We appreciate
Welcome.
your visit. Thank you.